Okay, good afternoon, everyone, and good evening. If you have people who are joining from outside of the US, I think I've seen one registration from abroad. Good afternoon, good evening. My name is Asenath Dande. I'm the Director for International Faculty and Scholar Services at Rutgers Global, Office of International Student and Scholar Services. I would like to also acknowledge our Vice President of Rutgers Global Affairs, who is online, Dr. Eric Garfunkel, who is in the audience. Rutgers Global is a university-wide office which handles everything global, including study abroad, global partnerships, global programming, and other initiatives, just to name a few. Thank you, Dr. Garfunkel, for your encouraging spirit for programming such as this to discuss topics that affect millions of people, both locally and globally. I would like to welcome everyone to our second event of the International Scholar Speaker Series. This is a fairly new initiative at Rutgers Global, which we launched in spring of 2022. The International Speaker Series aims to highlight and to showcase the important and diverse research and teaching that our international faculty and scholars are engaged in, and their contributions locally to the Rutgers community, the surrounding communities, and to the state of New Jersey, as well as global reach. So it's now my pleasure to introduce two most important people in this event, but I'll begin with Dr. Sackey. So Dr. Joachim Sackey is an assistant professor in the Department of Clinical and Preventive Nutrition Sciences at Rutgers University School of Health Professions, Rutgers Biomedical and Health Sciences. Dr. Sackey is also affiliated with the Department of Urban Global Public Health at Rutgers School of Public Health as an assistant professor. Dr. Sackey has also been an associate member of Rutgers University School of Graduate Studies since 2018, and a core faculty member of Rutgers Global Health Institute since 2021. Dr. Sackey also serves on several institutional committees to help advance this important work. Dr. Sackey received his Master's of Science and Ph.D. degrees in nutritional epidemiology from the Friedman School of Nutrition Science and Policy at Tufts University, and a Master of Philosophy from the University of Ghana in dietetics. Dr. Sackey is an internationally renowned nutritional epidemiologist with interest in food insecurity, HIV-related comorbidities associated with poor diet, as well as racial and sexual minority health. He is known for his research, scholarship, and teaching on food insecurity among people living with HIV, college students, and individuals identifying as lesbian, gay, bisexual, transgender, queer, and intersex. Dr. Sackey's research, scholarship, and teaching has helped scientists to understand the prevalence of factors associated with food insecurity within these populations. His research achievements have had a profound global impact in the field of nutritional epidemiology, both in the US and abroad. Dr. Sackey currently conducts research in Newark, Botswana, and Senegal. Just to keep it short. So it's now my pleasure to welcome Dr. Sackey to share what he has prepared for today. However, before then, I would like to introduce Mr. Carlos Santoro, who's the Rutgers Global Senior International Faculty and Scholar Advisor. Mr. Santoro has been with us for 7 years, and he will be a moderator for today for this event. So welcome to both of you.
Thank you very much, Asnath, for that very nice introduction. I think before we get started, I'd like to just give a couple of housekeeping rules, so to speak. You will have the opportunity to ask questions. There will be breaks within the presentation where you can put your questions in the chat of the Zoom session, and we will look at the more relevant questions to that specific section as we go along. All other questions we will address at the end of the presentation. Of course, at the end, if you have any other questions, please put them in at that time. So again, use the chat. There will be breaks where we will review any questions that were added, and we will address them if they are relevant to the immediate section. Now, We had a great introduction for Dr. Sackey, so I won't waste any time. Dr. Sackey, perhaps you can start out with the outline, and then maybe I'll begin with a question.
Thanks, Carlo. Okay, so here's the outline of the presentation. I'll speak a bit about my journey and how food security, which is the main topic, is defined and measured. And then I'll speak about some statistics related to food insecurity on the global, federal, and local levels, go into some solutions to address this issue, and then end with like a couple of studies we've done among some vulnerable population subgroups.
Okay. Well, Dr. Sackey, you have a very impressive resume reflecting diverse experiences that have brought you to where you are today. Tell us a bit more about the journey from your origins to your current position as a renowned expert on food insecurity.
Yeah. So as Asnath graciously introduced me, I started at the University of Ghana with I studied nutrition and food science, and then went on to do dietetics for my master's. And then after a while, I wanted to get more into the research side of things and the data side. So I got a chance to come to Tufts to study nutritional epidemiology, and I did my MS and Ph.D. there. And then a few months after I completed my Ph.D., I joined Rutgers, the School of Health Professions, where I'm on the teaching track. And then I'm also an adjunct at the Tufts School of Medicine, and I also teach in the School of Public Health. And here are some courses I teach and direct currently. So I teach like statistics and nutrition epidemiology courses. I also teach global and public health nutrition, as well as other research courses. And I give some lectures to the infectious disease fellows in the New Jersey Medical School as well. And in terms of research, my research also revolves around food insecurity and how it impacts cardiovascular diseases, especially those that are diet-related. And I study various groups, people living with HIV, those who identify as LGBTQ, college students. And we started a Rutgers Food Pantry recently that I'll speak about too.
So, Dr. Sackey, many of us are familiar with the term or have heard the term food insecurity, but perhaps we may not know the actual definition of the term and especially the reality of the issue. Can you please provide some clarity on this topic?
Yeah, thanks. Yeah, so here I have two definitions of food security, like the UN definition as well as the US Department of Agriculture definition. So the UN's definition speaks about how all people at all times having access. And access could be physical, it could be economic, it could be social, to sufficient, safe, and nutritious food. That means their preferences and dietary needs. And the USDA definition is somehow similar and also speaks about having food in a socially acceptable way. So those speak to like the dignity of how a person acquires food, you know. And there are four main dimensions of food security. So having availability of food, being able to utilize the food safely, so like food safety issues, and then having access, so not just physical access, but economic access to food, and then having all these dimensions in a stable manner so that you don't have to worry about any of them. Those are what those are the dimensions of food security. And in different parts of the world, all four pillars are issues that should be dealt with. But in the US, food insecurity is mainly an issue of economic access. It's a poverty issue. It also applies globally, but in the US, it's mainly a poverty issue. And in terms of how food security is measured, in the US, the United States Department of Agriculture uses the Household Food Security Survey model to measure food insecurity. In other parts of the world, the HFIAS, the Food Insecurity Experience Scale, and the Household Hunger Scale are various scales or questionnaires or tools that are used to measure food insecurity. And a lot of studies have shown that being food insecure is associated with so many health outcomes. So this is a graphic courtesy of Feeding America, which shows being food insecure impacts the growth of children, is associated with higher healthcare costs and utilization, and also missed work days and lower income. So there are health implications, there are financial implications.
Many international organizations have addressed the issue of food insecurity, including the Food and Agricultural Organization of the UN, the International Fund for Agricultural Development, UNICEF, and the World Health Organization. Can you give us a snapshot of food insecurity on the level?
Yes, so here I'll just share some details from the 2021 State of Food Insecurity in the World report. So before the pandemic even happened, the COVID-19 pandemic happened, the world wasn't on track to meet commitments to end world hunger. And unfortunately, the COVID-19 pandemic worsened things and has made this goal more challenging. So hunger has increased, and it's estimated that about 800 million people in the world were hungry in 2020. And food insecurity is you might not have the food you want or enough of what you want, but hunger is hunger, meaning you have nothing to eat. And in less resource parts of the world, hunger is a huge issue that people are dealing with. So this is a graph that just shows the trend of undernourishment in the world and how the numbers where it decreased early in 2009, 2010, remained stable. And unfortunately, due to the COVID-19 pandemic, there was a rise between 2019 and 2020. And here, this figure just shows the proportion of people in the world who are undernourished, so like 768 million. And if you look at where these people are located, you see that most of them are in Asia, followed by Africa. And in more resource parts of the world, like North America, it's just a tiny proportion of people who are undernourished. Okay. And this is more trend analysis that shows how food insecurity, unfortunately, is increasing across the whole world, especially in Africa, in Asia, and Latin America. Northern America and Europe, which has more resources, it decreased, but it went up slightly between 2019 and 2020. And here is a chart that shows how in 2017, which is the latest data we have for this particular criteria, over 3 billion people in the world could not afford a healthy diet. And even though this is 38.3% of the world, there is a lot of disparity. So throughout my talk, I'll speak about disparity on a global level, federal level, and local level. So this 38.3%, if you look at it by continent, about 74% of people in Africa could not afford a healthy diet, compared to just 3.7% in Northern America and Europe. And if you think back to the dimensions, when I mentioned poverty being a main driver, when the world is grouped into, or countries are grouped by income levels, you realize that it's not an Africa issue. It's a poverty issue, because low-income countries, about 86% of people can't afford a healthy diet, compared to high-income countries where it's just 2%. So it's like the disparity is a resource issue. And here is just like a figure that shows the interconnected factors that influence the food systems and influence nutrition and health. So there's policy, there are supply chain issues, there's behavior, there's the agri side, production of food, and a whole lot of factors that interplay to influence like people's diets, nutrition and health, and various broader impacts. And this is another graphic from the State of Food Insecurity report that just shows how interconnected food is. So to solve food insecurity or food issues, we can't just give food. Like there are other factors that needs to be tackled alongside. So the environment is very important. In many parts of the world where farmers rely on the rain, change in climate is causing a lot of problems. Social protection issues. Later, I'll speak about how food insecurity is not just a food issue, it goes beyond food. Health is key. In the US, a lot of people are bankrupted or become food insecure when they incur medical debt. So addressing health systems would have an impact on food as well.
Well, this is a very complex and multifaceted issue, Dr. Sackey. Do we have any questions in the chat right now? If we do not, then I think we can move forward. Okay. I mean, these are all very compelling statistics, Dr. Sackey. Can you elaborate on the issue of food insecurity and perhaps the contributing factors in the United States?
Yes. So in the United States, as I mentioned previously, the USDA surveys food insecurity, and specifically the Economic Research Service within the USDA is the group that publishes like annual and regular reports. So the most recent data showed that there was a non-significant drop in food insecurity prevalence from 10.5 to 10.2% between 2020 and 2021. But when you look at households with children, there was a significant drop from 14.8 to 12.5%. And part of this is due to the various measures that the federal government put in place during the COVID-19 pandemic, including making school meals free universally, the child tax credit, and other social initiatives that helped reduce food insecurity in households with children. So here on the left, you see a figure where the USDA compares 2020 and 2021 data, and where there are significant changes, it stars them. And on the right here is a map they also published that shows food insecurity on a state level, with some states having food insecurity levels lower than the national prevalence, which is the pale color, or at the average or above the average. So these states have food insecurity prevalence higher than the national average. And I'll come back to this map in a few slides. So here is data on the state of New Jersey, where in 2021, 8.3% of people living in New Jersey were food insecure. And here you even see the disparity on a county level. So on some counties like Cape May, Cumberland, Essex County, where RBHS New York is, the prevalence is 10.7% or above. And then there are other counties within the state where the prevalence is as low as 5.2%. Yeah. And because I'm based primarily in New York, I just wanted to also spotlight this report that the New Jersey Economic Development Authority put out, looking at communities that might be food deserts, which could get some targeted interventions. And after ranking them, all parts of New York where RBHS New York is located falls in the top 10 of food deserts. So every part of New York is in a food desert. So that tells you the kind of people who need help. And if we are thinking of targeting resources, we need to look at communities like New York. So any questions on food insecurity in the US?
Wow, we have food insecurity right in our own homes, which is very eye-opening. I don't see any questions in the chat, so I will move forward. So Dr. Sackey, we're getting the sense that there are many different factors contributing to food insecurity. Can you please elaborate on some of the other causes and perhaps touch on possible solutions?
Yes. So like I said, food insecurity is not just a food issue, but there are other things that are tightly related to it. And to solve food insecurity, all these other issues have to be addressed as well. So here on the left, you see the map I showed earlier that showed food insecurity on a statewide level. And I want you to visually focus on the states with food insecurity prevalence above the national average. And if you look at this map that shows minimum wage, a lot of these states have the lowest minimum wage as well. Here we are comparing it with obesity. So a lot of these states with high food insecurity also have high obesity levels in the 35 to 40% range. And here is data that is looking at access to healthcare. And a lot of these same states with high food insecurity levels also fall in the fourth or bottom quintile in terms of access to healthcare. So food insecurity is linked with health, it's linked with income, it's linked with obesity, it's linked with so many other things. And all those things need to be considered as we think of solutions. So there are some direct policy solutions that can be taken on a federal level to solve food insecurity. One is strengthening the federal assistance programs, primarily SNAP, which is like the first line of defense. So improving SNAP, expanding SNAP benefits, improving or increasing the proportion of fruits and vegetable component of SNAP benefits would be very helpful. Other federal policies that would help the situation is like going back to the universal school meal. So COVID was very unfortunate, but it provided the grounds for a huge natural experiment where it showed that when all children were given meals free, it improved happiness, it improved their learning, it reduced food insecurity. So that is something that we've shown that it works. Now it's gone back, but it's something we need to advocate for as people interested in health. And then improving SNAP and other programs like the emergency senior nutrition programs would also directly improve food insecurity. And we also need to advocate or to the federal government and to those in Washington to direct like investments better. So on the left, you see the MyPlate, which is the visual tool that the USDA puts out to visualize the dietary guidelines for Americans. And it recommends that half of your plate should be full of fruits and vegetables. And on the right, you see a chart that shows subsidies and bailouts in 2020 to the tune of 53 billion. And fruits and vegetables are the red part of the slice, and plant proteins like legumes and nuts are the green part. So what should be half of our plate is the red and green portion, very tiny proportion of subsidies. So just imagine if that is doubled or tripled. It would improve access to fruits and vegetables and to allow many people to be able to eat healthier, which would have like a lot of direct benefits, not only on food insecurity, but on various diet-related diseases. And then there are these other indirect policy solutions that would also have an impact on food insecurity. So increasing the minimum wage, like you saw the map, that's where I contrasted food insecurity and minimum wage. So increasing minimum wage will allow people more income and they can eat healthier. Currently, the housing security, like increase in rent, inflation, fuel, all those things are leading many people to make that difficult decision of, do I pay my bills or do I buy food? If I'm buying food, I have to buy what I can stretch my money to get a lot that will last a long time. And then that's where people are not able to consume as much fruits and vegetables and other healthy foods as they should. And then things like universal health care, when you wouldn't be medically indebted, and that will impact your food insecurity, that would also help the scenario. Then other things like having safe communities. So if we think back to the food desert map I showed in New Jersey, like fiscal access is an issue. So when a community is not safe, businesses are not going to invest there, and then they wouldn't have access to healthy food. So if we have safe communities, people will be more active. They go out to work, businesses would invest there, more grocery shops would open, and it would help the food security issue. So here, this is a graphic that Politico published not too long ago that shows like all households in deep green and then in households with children. And here they were just trying to tell the story of how the government interventions during the pandemic had a positive impact on food insecurity. So as you can see, anytime stimulus checks were released, food insecurity went down in all households and in households with children. And at certain points, the decrease was higher in households with children when there were things that were targeted to children. So for example, the third stimulus check, like the prevalence of food insecurity in households with children decreased more than in all households. And when the child tax credits also went out, the prevalence fell like more than in all households. So these are federal interventions that worked, that helped, that have gone away and are contributing to food insecurity being like such a huge issue now. And then on an individual level, there are things we can all do as individuals. So for those who work in like health facilities, the screening patients who come to the hospital for food insecurity, and then having resources to either provide them food or refer them to nearby food pantries or soup kitchens would help food insecurity. We can organize food drives on Rutgers or wherever it is we are, where we live, where we work, and donate it to various food pantries. Or we can, for those of us in clinic or in clinical settings, we can have food packages that we can give out to our clients who are food insecure. And then a few weeks ago on September 28th, the second White House Conference on Hunger, Nutrition, and Health was held. And this was a momentous event that led to a strategy being put out that everyone can follow in terms of how to solve hunger in the US. I started speaking about the White House Conference and the 5 pillars and how the first one was improving the access and affordability of food. And the second one was integrating nutrition and health in terms of Medicaid and Medicare. And then the last 3 was the third one was where I was speaking about how, in my personal view, I felt it could be strengthened because there were lots of proposals and voluntary targets for industry when it could have they could have proposed laws to expand or to force like USD or the FDA improve the nutrition labels, for example, or set targets for sodium and added sugar. And then the fourth one was improving physical activity. And the final one was like enhancing nutrition and food security research. So so that we can have better data and that could be fed to policymakers to improve policy actions. And then
Dr. Sackey, we did receive some very interesting questions.
Okay.
Could you elaborate more on food waste and how this relates to food insecurity? And what kind of synergies can be created between the two issues to find solutions?
Yeah, so food waste is a big issue because you have, even in New York, which, like I said, all of New York is in a food desert, you have a situation where there are restaurants and grocery shops throw away lots of food that is healthy that people could eat and they don't have access to. So there needs to be a better conversation and there needs to be policy to allow food, like those who deal with food, to be able to give out food in a way that they wouldn't face legal liability. So there's always a food safety issue, and whilst after a while it might be safer to throw away when people could eat that food. So I know the food bank gets a lot of donations from various industries and grocery shops, for example, where the things are almost expired and they donate it to the food bank and the food bank donate it to food pantries like ours, for example. And then there are also food rescue initiatives. I think there might be one on Rutgers, New Brunswick, even where, for example, events are held, there is food that not all is used, and instead of it being wasted, it's rescued and delivered to nearby kitchens or the rest. But a lot of these are happening on a local level, but having stronger policy to streamline things would be healthier.
That's great. We have one more question as well. How can individuals and communities explore solutions to the food desert issue on a state level?
Yeah, so I would say advocate, right? We need to advocate to the policymakers. So if on the state level, the state legislature is there, so we need to advocate to the mayors, to those on the various city councils, to those in Trenton, so that laws are passed to improve things. And at the same time, if, for example, a community is not safe, like I said, it will be difficult to encourage businesses or grocery stores or food shops to come and open up there. So that aspect of it too has to be addressed. But all we can do is to advocate. There are some communities where they come together to do, start with, let's say, an urban farm or a small community garden, and then they sell it in farmers market in open places, and then they graduate to physical grocery stores. But those are all individual local things that happen. But if we can advocate and there's more resources that are invested in underserved communities, that would help a lot.
Well, thank you for that very eye-opening information. Let's move forward and then we'll get to some more questions later. So, Dr. Sackey, is food insecurity more prevalent among certain groups in our society? And if so, how does it affect these specific groups?
Yeah, it is more prevalent in certain population subgroups, and in this presentation I'll speak about two of them who I work with. So adults who identify as LGBTQIA as well as college students. So before sharing statistics on food insecurity, I just want to highlight the fact that the term LGBTQIA is a complex term that encompasses both sexual orientation, gender identity, as well as sex as birth. So the LGB is talks about a person's sexual orientation. Transgender is a gender identity term. Queer is an all-encompassing term that describes various sexual and gender identities that are not straight. Then intersex is a sex at birth term, and asexual is a sexual orientation term. So even though it's an acronym that is used commonly, it has a lot of various components to it. And on the right are some common tools that are used like in clinic to educate people on the various like the various phrases and what they mean. So like what gender identity means, how a person identifies, how a person expresses their gender with their dressing or other things. Then there's a sex assigned at birth, which is what you find on your birth certificate. And then there's the attraction, sexual attraction, and romantic attraction. So even before the pandemic happened, those who identified as LGBTQIA were found to have higher risk of food insecurity compared to the rest of the population. And in a large study conducted in 2017, but this report was in 2020 by Wilson and Conron, they found a prevalence of 26.7%. So if you remember, the federal prevalence this year is 10.2, but before then it was 10.5. So this was like more than double the federal prevalence of food insecurity. And even within LGBTQIs, there are various disparities. So for example, on the left, you can see there's a disparity by age, right? With the prevalence of food insecurity among those 18 to 34 being more than twice that of those who are 65 or older. And this could be due to a variety of issues. Many of the older LGBTQIs came out at a time when society was more accepting and they're also more established in their career path. And so they had like resources. And so coming out didn't like impact them negatively compared to the young people where some of them, when they come out as LGBT, some of them lose the support of their families, some of them lose housing, some of them go through a lot of stigma and things, and some of them drop out of school, some of them struggle to get back into the workforce, and so they are more vulnerable to food insecurity. And then there are also like racial and ethnic disparities. So for example, the prevalence was highest in non-Hispanic Blacks, followed by non-Hispanic multiracial people. And together with colleagues in the medical school, Dr. Finkel, and our community partner, the North Jersey Community Research Institute, we've done a couple of pilot studies exploring this issue. So the first one, which was funded by the NGX projects, looked at food insecurity, diet quality, and cardiovascular disease risk factors. And the second one, led by Dr. Finkel from the New Jersey Medical School, looked at resilience, food insecurity, and health outcomes that focused only on like those who were transgender. So in the NGX study, we found that 40% of the sample were food insecure, and that was even higher in the trans study where it was like 56%. And in terms of cardiovascular disease risk factors, the sample in both studies were young, about 30 years of age, but their body mass indexes were quite high. So if you combine overweight and obese, over 50% of participants in both studies were overweight or obese, which increases your risk of cardiovascular disease. And then LDL cholesterol or low density lipoprotein, the LDL cholesterol, which is like the bad cholesterol in quotes, was also quite high. So in the NGX study, over a third of them had elevated LDL cholesterol, and the resilience study, it was a quarter of them. And if you look at these are people in their 30s, that is not ideal.
Dr. Sackey, we do have quite a few questions, and I think we'll save them for the end, but we have a very nice comment that was just given. It says, "You are so right." Dr. Sackey is so right. "Food sharing is a deeply instinctive human behavior, and for many, an important way of maintaining food insecurity. We have to lose this false sell or waste dichotomy." So obviously food insecurity, food waste are concerns to many. Going back to our questions, Dr. Sackey, do you see any problem of food insecurity affecting other groups that we may not even suspect?
Yeah, so that leads to the food insecurity among college students, who are another population that my research focuses on, where people have this idea of a college student being on campus and they're having fun, but there's a lot of food insecurity in this population as well. And before the pandemic happened, food insecurity prevalence was consistently higher among college students compared to the rest of the country. So just remember the USDA prevalence of 10.5 or 10.2%. Here, this has a couple of systematic reviews that were published in 2017 and 2019 that showed like a prevalence of food insecurity of about 40% among college students, which is like almost 4 times the national prevalence. And studies have also shown when college students are food insecure, it impacts academic work, it impacts their financial independence, and it impacts their health as well. So I've also done a couple of studies in RBHS New York in 2020 and 2021, where we looked at food insecurity. The prevalence in 2020 was almost 30%. It was slightly lower in 2021, but at 22%, but still double the national prevalence of 10.2%. And in the study in 2021, like 15% reported how the pandemic had increased their level of food insecurity. Yeah. So both of the studies we did in RBHS was shared with the Office of the Chancellor, and somewhere in September, he gave approval for us to start a food pantry for the RBHS campus. This is because Rutgers New York has a student food pantry, Camden has a student food pantry, New Brunswick, where I am now, has a student food pantry, but the RBHS in New York did not have anything. So we opened in 2021, once a week, and as at September, we had given out over 105,000 pounds of food. We had served about 13,000 individuals and given out a lot of diapers and wipes and non-food products. And in addition to giving out food and non-food items, we also assist with SNAP enrollment. So if a student is food insecure and might be eligible for SNAP, we work with them and then we refer them to experts at the community food bank who would help them like apply for SNAP. And we are open to all students, faculty, and staff. Like, you don't need to prove need, just come get food. Everyone needs help sometimes. And for those of you on other campuses, I just wanted to just list the various camp food pantries available as well, so that you could access it if you need it, or share the information like with your students, for example. So there's pantry run at Rutgers New York. Then in New Brunswick, there's a Rutgers Student Food Pantry on College Ave. And then Camden has a Raptor Pantry. And so I'll just end like with this speech that, or this quote from Martin Luther King when he was accepting the Nobel Peace Prize long ago, where he had the audacity to believe that people everywhere could have 3 meals a day for their bodies, and education and culture for their minds. And if you just focus on the 3 meals a day part, it's very sad that it's 2022 in the United States of America. More food than is needed is produced. A lot of food is wasted. And yet, for some people, the 3 meals a day is not a reality, or it's not a consistent reality. So that's just food for thought for us to think. Like in the United States, food insecurity is very solvable easily if there's a political will to put in place the right policy. But unfortunately, it's not there yet. And here's my email address if you want to get in touch with us to talk about anything.
Well, thank you, Dr. Sackey. That was a very compelling and eye-opening presentation. You've given us much to think about and actually much more to act upon. We did receive quite a few excellent questions. So if you don't mind, I will go through them. Let's go from the beginning here. Would you be able to speak to the connection of food insecurity and behavioral health? And if the use of vertical farming, hydroponics remains an opportunity to reduce insecurities while promoting improved physical and mental health?
Yeah, so behavioral health, yeah, there's a link with food insecurity, because the way a person has to acquire food impacts their behavior, right? There have been studies that have been conducted in various populations that shows when people are food insecure and they have to, for example, go to a pantry, or they have to form a queue to get food, or get food in socially unacceptable ways, it affects their dignity, it affects their mental health. So definitely it has an impact on behavioral health. And you mentioned vertical farming or agriculture. Yeah, that is part of the solution, because the COVID-19 showed how the food system was not resilient. Where when borders shut down, people had to stay in place. You realize that your food is coming from Africa or somewhere. If it can't get to you, then that means you don't have the food you want. So there was the drive to improve the resiliency of local food systems. And in urban towns like Newark or New Brunswick or other urban areas, vertical agriculture is one way where like the little land available can be used effectively, and it also provides a way to connect people with their food. So I come from Ghana, and we used to farm for many years until I was fortunate enough to go to college and there. So I know how food is farmed, how animals are killed for meat, etc. But many people are very separated from their food. They get their food from the supermarket and have no idea how it gets there even. So if you don't live in close proximity to a farm, or you don't live in a farming community, vertical farming, urban gardens, things like that are ways where we could introduce like children in school to agriculture, so that you know how food is farmed, how it gets to you, and that improves their food choices. A lot of farm to school interventions have shown that when children are involved in like the planting, they have in a small bed, they grow one vegetable or so, they are willing to try that food to eat it, and like their diet quality can improve as a result.
Well, from a related question, from the food production perspective, what do you see as the greatest challenge facing world food security?
I would say climate change, because a lot of farmers in Africa and Asia, where they don't have a lot of resources, these are people who are dealing with, let's say, an acre or two of land, where they are using hoes and cutlasses to manually farm, no irrigation, no like radar or any advanced technology, and they depend on the rains falling at particular points for them to plant and the rest. And when that changes, even if it shifts by a week or two, it could affect planting, which could affect like the next harvesting season and the rest. Or if you think of like the recent floods that have been happening in various parts of the world, like the Pakistan flood, for example, is going to affect a planting cycle for maybe a year, if not more, which would affect like food that will be harvested in the future. So it's going to have a huge impact. In the Horn of Africa, like the drought is causing a lot of challenges. So if you can't plant at when you should plant, that means you can't harvest food and people are going to starve. So climate change, I would say, is the biggest issue of concern.
Mm. Could, getting back to the issue of food waste, could food waste also improve agriculture or farming practices by composting food waste from restaurants or grocery stores or local communities, or by making residential composting more accessible for communities?
Yeah, that would help. I know, like New York City, for example, I don't know that they've passed a rule about composting or they're trying to start, but yeah, that is one way to reduce food waste, right? But even before the food gets composted, too much food that people are hungry and need to eat, like is wasted. So there needs to be like a better system of getting food from when a restaurant or a grocery store does not want it to people who need to eat. And then like what is not eaten can then be composted. And that's where like the system doesn't work well, or it's in communities where like they have good infrastructure or good planning, like they're able to make things work better. But yeah, they need to be better, whether the word is synergy or alignment, so that food gets to people who need to eat, and then what is not eaten is can be composted.
That's great. Do you think a hospital can set up or help set up a food pantry for patients or for the greater community that it serves?
Yeah, definitely. There are lots of examples. I know in Newark, if I'm getting the name right, like the Beth Israel Hospital, for example, has like a wonderful in-house pantry. They might even have like a garden or a little farm where like they give out food to their people in need. So, I mean, when a person comes to the hospital, it's a good way to catch people who might be food insecure. So you can screen them for food insecurity, and then you can refer them to external resources, or better still, if you have the ability, set up a food pantry in-house for clients who would be in need. So yeah, that's a lot of hospitals have done that, and I know like more and more hospitals have plans to do that. I've heard rumors like the University Hospital like wishes to do something like that for its clients, but I don't know like the detailed plans.
I don't see any more questions, but boy, you have so many comments thanking you for this presentation. It was so much great information. They feel that they know much more about the subject than before, what to do to help. We just got another question. Are you currently researching or studying in any new area of food insecurity?
So I'm working with Dr. Shona Downs in public health. We are looking at infant and young child feeding practices in Senegal, where it has an indirect link to agriculture and food production. So there we are looking at where we can use like text messages to educate mothers on how to feed like their children healthier food. But the big issue that like the particular grant you are working on doesn't cover is if the person does not have access to the food, giving them education on how to feed their children better would not solve it. So ideally, we would like to look at, for example, the food production there and how we can encourage things like sack gardens or like production of more fruits and vegetables in a way that works for that environment, so that they can like feed their children healthy food. So those are things I'm looking at. And personally, I didn't do a lot of food policy, but like I said, in the US, for example, everything comes back to policy. Everything comes back to the Senate and the Congress. And if SNAP, if WIC, if the minimum wage, all those things are addressed, it would go a long way to solving the issue in the US. So now I'm just trying to learn more about how do we, as researchers, how do we do research, or how do we communicate our research in a way that we can advocate to policymakers and it would impact their policy choices or decisions.
Indeed. We have a note. Asanath said that if any of you have any questions you'd prefer to ask, live, you can unmute yourselves, and by all means, please ask Dr. Sackey directly.
Dr. Sackey, I saw that one of the solutions for food security was universal health care. Can you explain more how that would affect food security within the community?
Yeah, so in the US, for example, we have a scenario where someone is underinsured or uninsured, and you go to the hospital and you get a bill that is way more than you expect. Even for those of us with health insurance, you always see the claims, like what the hospital is charging and what your insurance ends up paying. So if you don't have health insurance or you're underinsured, then that is money that comes that you are due for. I know in Rutgers, for example, this is a time for open enrollment ending. And some people, because the health premiums are so expensive, some people are going to make the choice to choose high deductible plans, right? Where their monthly premiums are low, but you have high deductible. So that would mean you could go to the hospital and face a bill in $10,000 or more that you have to suddenly come up with. And that can suddenly, you have to make a decision, pay bills or buy food. So medical debt contributes to food insecurity. And if like healthcare access or access to healthcare was universal and free, and you don't have to worry about that, that will free up money that people can use to eat healthier.
Thank you.
Thank you.
I have a question for you. For African countries, I'm from Kenya originally. I'm wondering what could be done to help, because we are dependent on the seasons, like the rainy season, and how can this issue be resolved? Is it a government policy? Is it something the government can do in terms of maybe even providing fertilizer? Because many families have small pieces of land and they farm it like year after year after year. And sometimes it's not, the soil is not good enough to produce any more good, good maize or whatever it is.
Yeah, definitely. That would be of great help. So if we think of the fact that let's say the US generously donates a lot of food, right, to needy parts of the world, maybe prioritizing more like agric extension support. How do we have innovative and cheap irrigation systems or micro irrigation systems that like a farmer who has just an acre of land who doesn't have a tractor or so will be able to do? How do we decentralize or make available satellite data that shows like the state of the soil or things like that? Like even how I know when I came to the US, one of the things that shocked me was how the weather forecast work, right? It works. You can know it's going to rain tomorrow at this hour, and it's a pretty good estimation. That is information that many people in many parts of the world just do not have access to. So even the data is out there, making it available on platforms that these farmers who don't have access to broadband also will be able to utilize. That would also help. And then like education is quite important. So you have a scenario where, unfortunately, in some parts of Africa also, you go into farming when you can't make it academically. So if you think of the fact that if a person can't read, how is that person supposed to understand that dilute 1 gallon of pesticide in 3 liters of water for 1 acre of land? So if I have 2.5 acres of land, think of the math involved. If I don't understand that and I don't have the help of an agric extension person to help me, that means I'll just be over fertilizing or under fertilizing or using too much pesticides and things like that, you know. And then also when foreign governments are giving aid to countries, I think it has to be more prioritized. So you have a scenario where, like, I come from Ghana. Every time the roads in the capital Accra, which doesn't produce a lot of food, they are being paved and repaved and repaved. And the farm communities have terrible roads. So farmers grow food and they can't transport it because the roads are terrible, vehicles can't get there. So maybe if you can put conditions in place like get roads to their farming communities, that would help. So these are just some ways that policy or pressure could be put and the right kind of investments made.
That's great.
Thank you. That's wonderful.
Any other questions? This is your chance.
Yes, so as a member of the food industry, we have started in the last couple of years focusing a lot on making sure our supply chains are doing the right things. But are there any other areas of focus that the food industry and manufacturing should be doing in the US?
Yeah, I mean, at the end of the day, the food industry has done an amazing job of making calories cheap. So if you think of like 50, 60 years ago, where even in the US, undernutrition was such an issue, and now the food industry has done so much good that calories are cheap and undernutrition isn't a big issue in the US. Overnutrition is the challenge now, right? So the question is how, if the food industry could do things like reduce added sugar, reduce sodium, things like that would help. But the food industry is also in it for money, like they are in it for business. And so that's where, how do we make laws or policies that would compel them so that foods are healthier? You know, how do we, even the kind of labeling, like, right, you pick a pack of chips or something and it's like, even for a nutrition person, the labeling is not as simple as it could be, you know. So policies to compel them to make like the labeling clearer would help. And also minimally processed food. So we need more minimally processed food because fruits and vegetables go bad quickly. So how do we, whether it is package them in a way that they can last a few more days or something like that will help. There are people who come to like our pantry, for example, or other pantries where they might not have a refrigerator. They only have, let's say, a microwave oven. So if you give them a lot of fresh produce, what they can use that day or cook that day is going to go bad. So those are some ways that the food industry could help. But some of them, I think, policy needs to be passed to encourage them.
Dr. Sackey, we have Professor Albert Ayeni has had his hand up patiently waiting for a while. Professor Ayeni, can you unmute yourself and ask your question?
Thank you so much, sir. And thank you for this very beautiful presentation. I'm glad you touched on all the important aspects of global food security. But the one that concerns me most right now, I retired from Rutgers about a year ago, and one area that we see coming, and it does not seem many people are thinking about it, is making agriculture attractive enough for the younger folks. The younger folks, not just in the United States, even in Africa, I'm from Nigeria, and the population of Nigeria is about 200 million now. And the young ones don't want to go to agriculture. We have an unemployment of more than probably 30-something%. And agriculture seems to be the low-hanging fruit that could engage a lot of people. But young people don't want to go into it. So all of a sudden, we might find ourselves running into a situation where production becomes a challenge. Supplying enough food will become a challenge for everybody. So what do you see? What are you looking forward to in this area that is going to encourage younger folks to get involved in agriculture? If in New Jersey, 60% of the population of the people in agriculture, they are over 60 years old, 60, 65. The younger folks are not interested in going into it. So how do we handle this area?
Yeah, that's a very important point. I mean, like I said earlier, at least in Ghana, you have a situation where some people are pushed into agriculture if you can't, your parents can't afford to take you to school, or academically you are struggling, and that's not ideal. But I think investments or policies on the government level would help, right? Because if you have a scenario where, I remember when we used to go to farm where you walk multiple kilometers and you have to use the cutlass swinging, it's good physical activity, but it's back-breaking work that you do for many months to hopefully harvest. And then, for example, if the rains don't fall or the dry season goes too long, you lose all that harvest, and economically it's not rewarding. So in West Africa or Sub-Saharan Africa, like, it needs to be more rewarding as a career path to encourage people. We have, I know the University of Ghana, for example, has like degrees in agriculture and the rest, but many people finish those degrees and don't go into agriculture anyways because it's not economically rewarding. So that's where that's what has to change, and it's very complex, right? If you have a scenario where you spend your energy and efforts farming and you harvest, and then the food is sitting on your farm, you can't get it to the market, or it gets to the market and a middle person is going to buy it from you so cheap that it's not worth it that you went into farming. You are going to leave the farm, and then you have the rural-urban migration drift within countries. Everyone goes to the big cities to go and look for work that is less fiscally intense, and that should hopefully bring more money. And then no one is farming. And then to add or make matters worse, you have a scenario where, let's say Ghana, for example, one of our staple foods is rice. We don't grow enough rice. The rice we grow is like, I don't even think it's 1% of what we consume. So then we are dependent on importing food. And then with inflation, the cost of the local currency decreasing, cost of importing increasing, it compounds, its food prices are higher. So it's like it's a lot, and it's huge. There isn't one simple solution that I can say. It's just there has to be policy, but there have to be economic things, and that's where if, for example, you are in the US and you're thinking of like, why do people migrate? If someone is in desperate situations, they would find a way to migrate. They don't care about anything, and so when we are investing or giving aid to countries that are under-resourced, we should think of how best do we target that aid so that it would like improve food production. It would encourage more young people to enter farming, things like that.
Thank you.
Sounds like policy and economics are two very important drivers for any kind of significant change. Do we have any other questions? Yes, regional integration is key. Yep, that's important. Dr. Sackey, do you have any last comments that perhaps you'd like to share with our audience?
I'd just like to thank you for inviting me. And like I said, if anyone wants to have a conversation or has a project going on about food, I'm interested in speaking with them. And in the US, I think we need to do more advocacy. So like encourage advocacy irrespective of the field. Write a letter to your mayor, write a letter to your congressman or woman, write a letter to your senator to pass bills to improve some of the things you spoke about, like the minimum wage, or to vote for food-related bills. Because every year, a lot of bills are passed, but they don't get like don't get support, and so then they die and then they are reintroduced again. So personally, I now do a lot of advocacy in my courses. Like this, and I have advocacy assignments, encourage students to pick like a food or public health issue that is you are passionate about. You don't have to be in the field. Just pick something and then write a letter to your mayor, to the governor, to anybody, to just hopefully put pressure on them to pass laws that would help address these issues.
Wow. Dr. Sackey, that was just an amazing presentation. You've given us so much information, so much food for thought. We thank you from the bottom of our hearts for this very successful and very impactful presentation. I think we're all going home a little bit richer because of what we learned today.
Thank Dr. Garfunkel. I have to sit in his office and I've kicked him out. I don't know where he is now joining the meeting from. I apologize for the Zoom issues.
I think, is that Dr. Garfunkel's office?
Yes.
Yeah, I see him somewhere else, so perhaps.
Yeah.
Happily kicked out of my office to finish this presentation.
Great. Okay, Asana, would you like to thank Dr. Sackey as well? Or
yes.
Yes, Rick, I'll pass it on to you.
Sure. Thank you. Nice to see a bunch of you, Albert, and quite a few others of you. I hope we can do many more like this. It's going to be hard to beat, Joachim. This is very nice, very interesting presentation, but I'm sure we can come up with a few more to keep our audience well informed, keep all of our scholars well engaged. So thanks again for you and for everyone for presenting and having a lively chat conversation going on the side here too. Very helpful. Thanks again also Carlo and Asanath for putting this together.
Our pleasure. Thank you. All right. With that, we'll bid everyone a very good rest of the afternoon. Again, thank you so much for participating, and keep an eye out for our next Scholar Speaker Series.